good thing to marry with that, to say, okay,
Yeah.
we're doing all this testing, but meanwhile, East San Jose seems to be having
Yeah.
an inordinate amount of cases,
Yeah.
and now a group is speaking up about that.
My name is Professor Adrian Teopehua. I am a member of the Board of Directors of Centro Aztlan Chicomoztoc and a volunteer for the Barrio Defense Committee, which takes up issues in the Chicano Latino community that are issues that raise concerns, and we're a grassroots organization with members that help support making social change.
We're doing testing, we're getting these numbers, but the latest numbers seem to be disproportionately high in parts of East San Jose. What would you like to see done about that? What are your threats there?
Well, our coalition made an analyze this, and we see a number of different things that are part of the demands that we send out already to Assemblyman Cansanchu's office, Magdalena Carrasco's office, and Maya Esparza's office. And what it is that in the course of the pandemic, we have seen resources wasted, city and county lags of time, to the point where in our communities of Mexican, Chicano, Latino, Asian, and other minorities, there is a different outlook on the medical system, and there is fear for a lot of elders and other people who would not go out to test because they might be concerned about ICE, okay? And yet we are insisting that there has to be measures that are taken through public information, popular public information like flyers, posters, media, murals, billboards, that educate the community for the need. Because there's two resistance factors. One is the institutions that lagged in providing and identifying right away that there was an elevation of disproportionate numbers. The other point of resistance is the traditional cultural way that sometimes immigrants or other communities relate to medical care. There's traditional medicine, and then there's the medicine at the hospital. So, and they might be living in multiple families, so that the main concern is for the resources of the city of San Jose and the county in other capacities to be focused and be used to target and direct the resources directly at where the hot spots are.
Now, when you talk to people in those hot spots and say, go get tested, you say there's resistance. How come?
Well, Governor Newsom guaranteed privacy of people getting tested, supposedly so that immigrants could also get tested. But it didn't indicate what kind of privacy it was and how you communicated to people. Because number one, people are not watching Governor Newsom on television who are Spanish speaking, number one. Or other, Asian languages. So they're missing that point. And we see that already, for example, millions of dollars were put into creating a homeless trader camp at the county fairgrounds, and that's now a total waste because people are getting infected in that place. And so we have to, our demands, of which there are a number of them, are to be addressed to the leadership task force, meaning our public officials, our elected officials, that are looking into this now. We want to be our demands addressed publicly. And what we are requesting from them is a Zoom meeting or a virtual meeting or a face-to-face meeting so that we can make our observations and in a way, we were analyzing this before the officials were, because we had access to some stats from the county, website, and we started seeing the numbers, and we started seeing trends that were similar to LA, and yet it's different here now because they want to open up again for business.
Let me ask one question. As we head over this afternoon to SAP Center, and anyone can show up, they say, to have a test, do you think people from East San Jose would be less likely to show up and get the test, and why?
First of all, people in East San Jose are not into shark games. So there's no impression made on our community by the fact that it's being done at the SAP Center, even if Sharky's there. What we're really asking for is to go door to door if necessary, and Governor Newsom has created special workers in his staff force to make calls, check on people, but what is at issue also here is cultural competency. You can't train somebody in cultural competency overnight. Yet, they're going to be dealing with people, these call centers, that may just answer the call and hang up. So, there's barriers, like I said, on both sides. The harnessing of resources by the county and the city to really address this, right in the middle of budget hearings, and see what they do, let's say for the next phase, our own next phase here in this county, because there's 120,000 deaths throughout the nation under COVID-19. We're liable to be 1% or 2% down the line, but we want to avoid and head off a collision where we're like 10% or 20% of that total federal number, because we know that the majority of those dying, we know that the majority of those affected are low-income Chicanos, Mexicanos, Asians, blacks, and other minorities who are not even quite aware of what social distancing means and the need to wear a mask everywhere you go. Because the flow of information has not been popular. It stays on a website. We have a digital divide here still. So the flow of the information has to be transferred into, like I said, flyers posted, posters, billboards, and this costs money. The community doesn't have the money to bring itself up in this regard. The officials of the county and the city have to put money into this popular awareness campaign. And we're very concerned about our elders, okay? And because elders are very cuddled at home by our culture because they're taken care of. Yet you have adult workers, maybe sometimes working 2-3 jobs, that come home and they have the risk of having caught, because they're out there all the time, having caught the infection, and then they infect their elders without wanting to. So there are a lot of instructional messages that need to go out on how the different cultures have to approach this seriously. Because ultimately, we will see that, as I've already been expressed, that the essential workers, the delivery people, the caregivers, all the people who are essential that come from these minority groups, they're feeling like they're not essential workers, but disposable workers. So we're trying to prevent a major disaster happening and the virus catching on all over the place because it's centered in East San Jose, and that's a hot spot, and there's no control over it.
Excellent. That's a lot of stuff. Thank you, Professor. Do you mind? Un poco en español por Telemundo?
Sí.
Okay.
Oh, hang on a second. En español, so as in
In español, I can paraphrase what I just said.
Yes,
Okay.
please.
Mi nombre es Adrian Teopehua. Soy profesor y soy miembro voluntario de este Centro Aztlan Chicomoztoc, en donde existe el Barrio Defense Committee, el Comité de Defensa del Barrio. Estamos aquí hoy anunciando que tenemos muchas preocupaciones y las hemos puesto en demandas a nuestros oficiales locales y del condado para que pongan atención al por qué y cómo reducir la instancia de tantas infecciones que ocurren en esas comunidades y de las tantas muertes desproporcionadas que salen en esas comunidades. Y básicamente estamos exigiendo, uno de los puntos más importantes, es la educación popular. Educación popular con carteles, con volantes, con cartelones en las calles, todo eso, para educar a la comunidad de cómo se debe cuidar. Porque lo que podemos ver hacia un futuro es que se concentra el coronavirus en el lado oeste de San José y de ahí sale por todos lados. Porque esta es gente trabajadora, salen a trabajar, todavía trabajan y tal vez tengan una contagiación y no lo saben. Llegan a su casa, a veces a muchos miembros de dos familias viviendo en una casa, y ahí empieza otra vez la difusión del virus. Y no solo eso, se ha establecido recién, incluyendo unas resoluciones que el condado está estableciendo, tal vez la ciudad va a seguir, de tratar de ver esta situación. Pero tenemos que estar alertos para que lo hagan. Porque si no estamos alertos que se cumplen estas medidas y que se cumplen las medidas que estamos pidiendo nosotros, entonces es un patoche. Es un humito que para nomás ocultar lo que realmente está pasando. Y esa es la demanda principal de nuestro Comité de Defensa del Barrio, junto a una coalición que representan más de 10 grupos, organizaciones de no lucro y otras organizaciones de activismo. Entonces, les queremos pedir a todos ustedes que se cuiden de este virus, tómenlo serio, y cuando alguien les ofrece ayuda para protegerse, no la nieguen. Ahorita mismo es lo que estamos haciendo, ofreciendo la oportunidad para cuidarnos nosotros mismos, con el apoyo y obligación de los oficiales gubernamentales y administradores del condado y la ciudad.